Thank you, council members, for allowing me to speak. My name is Daniel Ryszka. I'm a pharmacist in New York State. I'm here to talk about the Buffalo medical cannabis movement. When people hear about marijuana, there's a lot of presumption. You think of Bob Marley, you think of illicit drugs, you think of arrests. A lot of bad connotations associated with that. But in reality, patients across the country are receiving benefit from cannabis. New York State has allowed the legalization of cannabis. Unfortunately, in Buffalo, they have not been allowed a registered organization to grow. So before we can understand cannabis, we have to understand where it came from. It's originally started in 12,000 BC, started out in Asia, moved down to Europe, Africa, South America, and eventually up into the United States. Back in 1851, cannabis was added to the NYS Pharmacopoeia, which means that this has medical benefit. Here's an example of one of the medications that was allowed. This has alcohol, cannabis, chloroform, and morphine. This was given as a cough syrup. This is considered medicine. Through the years, there's been a lot of changes in prohibition, which then made this illegal. From reefer madness in 1936, the fear of cannabis moving from Mexico up into the United States, states started pulling away from the medical benefits of cannabis. In 1942, everything was pulled off of the U.S. Pharmacopoeia as medicine. Big pharmaceutical companies came into play, and it has stayed illegal since 1942. Proposition 215 in 1996 allowed California to allow cannabis, one of the first states to actually revisit cannabis as medicine. As of September 2015, there are 23 states plus the District of Columbia that have legalized cannabis. 4 states have allowed this for recreational use. So how can cannabis be legal by the state and federally illegal? This is the crux of the matter. Basically, it's voted upon. You have the right and the decision to make that can affect thousands of patients in New York State and across the country. The CARES Act is currently submitted that would allow switching the scheduling from a Schedule I to a Schedule II. This would change the game for patients across the U.S. In New York State, according to the regulation that is out there, all the medications that are now being produced will have to have these chemicals on it. All these have a medicinal value. Some are psychoactive, some are non-psychoactive. The biggest one is THC, tetrahydrocannabinol. This is the psychoactive effect. There are medical values with this part of the plant. One of the products, called Marinol, is currently FDA allowed. It is the exact chemical structure to what is in the plant. This was a cartoon that someone put out. The plant in a smokable form is considered illegal. However, if you take that exact same structure, build this in a lab, add a whole bunch of ingredients to it, this has become legal and makes Wall Street investors very, very rich. There are definitely benefits of THC from pain reduction, antiemetic, anti-tumor, appetite stimulate, and sedative hypnotic. The opposite of THC is CBD. This is what we are fighting for, as well as the other parts of the plant. CBD has cannabidiol, several medical benefits, including anticonvulsants, antiemetics, anti-inflammatory, so forth. I'm not going to go into detail, but I have this here for your reference. There are several components of the plant that have psychoactive and non-psychoactive components. For patients, you may need a conjunction of both psychoactive and non-psychoactive for medical benefit. There's three classes of cannabinoids. One is called the endogenous cannabinoids. These are the cannabinoids that exist naturally in your body. They're already there. Every person here has this circulating. Then there's the phytocannabinoids. These are your THC, your CBD, etc. These are the cannabinoids that when added to your body can bring a desired effect. Then there's synthetic. Synthetic has medical benefits. They're usually listed by letters and numbers according to how they can design it. This is not to get confused with things that are currently out there. K2, spice, and bath salts, for example. These mimic THC, but have very unpredictable effects. Across the country, there's more and more overdoses that you're seeing from these other types of product versus the natural plant. New York State regulation, they're allowing three forms: liquid oil, vaporized, and capsules. This is what we're arguing about. This is what we're fighting for. Something that is not smoked by combustible light. This is something that is made by a dispensing facility that has appropriate medical benefit for patients who need it. There's only 10 indications that New York State has allowed for use of this product. Notice that there's not PTSD, diabetes, or glaucoma as one of them. There are potential benefits. New York State has not allowed it. There's also symptoms associated with those diseases which could also be covered. We're here today to talk because out of all the registered organizations, there are 5 of them. There'll be 20 dispensing facilities throughout New York State. There is not one grower in Western New York. What happens when it snows? What happens if there's a disaster? If there's a drug shortage? I'm a hospital pharmacy director. We see it every day. Where can these patients go that have switched their medications to a plant to get this product? There needs to be more accessibility. The growers for this area aren't in Western New York. They're in New York City and Long Island. The closest grower is in Rochester that will be dispensing not to Buffalo, but to New York City. There's a lot of considerations we have to take with this product. Polypharmacy, there's only going to be 5 strains allowed. There's 10 indications that are New York State approved. How can you treat 10 indications with 5 strains? Why did I get involved with this? Because of, one, my 2 children who have violent epilepsy that could benefit from this. They're not criminals. They're children in wheelchairs. They can't walk, can't talk, in a drug-induced coma. Close friends that I've met throughout this journey, they're fighting for their children. This is a typical medication profile for my child every day. 26 medications. This is a reality every day. There's several organizations that have patients that are looking for them for direction. We need leadership. We need someone to stand up for the patients, someone in a political realm to say, we're going to not follow what everyone else is doing. We're going to do what our patients need. This is a video of my daughter. This is a short seizure. Lasted about 15 minutes. They happen hundreds of times a day. They don't stop. This is considered normal, despite 26 medications. The side effects associated with those 26 medications, this is criminal that we have to watch day after day while this occurs. And we can't do anything because we're waiting for decision by the state. Invisible boundaries shouldn't dictate patient care. Politics, whether you're a Democrat, Republican, or other, shouldn't dictate how a patient should get access to medications. Thank you.